the worst drug that causes neuropathy and weakens legs after 50. If you're over 50, your body doesn't react to medications the same way it used to. And worse, some drugs you take daily might be silently destroying your health. Ever felt tingling in your feet, weakness in your legs, constant fatigue? If so, know that it might not be just aging, but the side effects of drugs you might not even realize are dangerous. In this video, you'll discover the medications that can most harm the human body with bizarre side effects. One of these medications is a major cause of neuropathy. It's the one you need to be most cautious about. The number one drug on this list deserves your utmost attention. It can cause peripheral neuropathy. And worse, many people are taking it without knowing the risks. If you want to preserve your health, avoid these drugs and find out what the safer alternatives are. Don't leave this video. This information could save your quality of life and prevent serious complications in the future. Number 14. Non-steroidal anti-inflammatory drugs NSAIDs. Non-steroidal anti-inflammatory drugs, or simply NSAIDs, are among the most consumed medications in the world. Ibuprofen, naproxen, and ketoprofen are used daily to treat pain, inflammation, and fever. But did you know these drugs can cause serious harm to your health, especially after 50? Continuous use can compromise your digestion, your kidneys, and even weaken your legs. This is because by interfering with blood flow and body healing, they directly affect muscle and bone regeneration. One of the main risks of NSAIDs is the aggression to the stomach and intestines. These medications reduce the production of prostaglandin, a substance essential for protecting the gastric mucosa. The result: increased risk of ulcers, bleeding, and even perforations in the digestive tract. Many people develop gastritis without realizing it, only feeling occasional discomfort. But in more severe cases, internal bleeding can be fatal, requiring hospitalization and blood transfusion. Another dangerous side effect of NSAIDs is their impact on the kidneys. Over time, they reduce blood circulation to these organs, increasing the risk of kidney failure. This means that if you're over 50 and use these drugs frequently, you might be overloading your kidneys without knowing. The problem is even greater for those with hypertension or diabetes, as the risk of kidney failure multiplies. But what do NSAIDs have to do with neuropathy and weakening of the legs? Simple. The least discussed side effect is the interference with blood circulation and muscle regeneration. When you use these medications regularly, muscle fiber recovery becomes slower, increasing the feeling of weakness and the risk of injuries. Moreover, the inflammatory effect on the nerves can cause numbness, tingling, and persistent pain in the lower limbs. The worst part is that excessive use of these anti-inflammatories can mask important pains, preventing you from noticing underlying problems, such as advanced osteoarthritis or early-stage peripheral neuropathy. Self-medication further aggravates the scenario, as many people take these drugs without medical supervision, increasing the risk of severe side effects. If you're over 50 and need to use NSAIDs frequently, it's essential to talk to a doctor about safer alternatives. If they are the only option, always follow the guidance of your trusted doctor. Number 13. Paracetamol. Paracetamol is one of the most popular painkillers in the world, used to relieve pain and fever. Its great appeal is its apparent safety compared to anti-inflammatories. But is it really harmless? The truth is that this drug can be a great danger, especially after 50. Why? Its toxic potential to the liver and risks to the kidneys. The liver is the main organ responsible for metabolizing paracetamol. When used in high doses or over extended periods, it can cause hepatic overload, resulting in severe damage such as drug-induced hepatitis and liver failure. One of the greatest risks is that symptoms of this problem can go unnoticed until the condition becomes critical. Weakness, nausea, abdominal pain, and yellowing of the skin are signs that should not be ignored. Another common issue associated with paracetamol is its combination with alcohol or other medications. Many people take this painkiller without realizing that other medications they regularly take contain the same substance. The excess can be lethal. Paracetamol overdose is one of the main causes of liver transplants worldwide. And how can this affect your legs and your neuromuscular health? The liver plays a vital role in the metabolism of nutrients and toxins. When it does not function properly, there is an accumulation of substances that can affect the nervous system. Moreover, liver issues can lead to fluid retention and muscle weakness, making the legs heavier and more painful. For mild to moderate pain, techniques such as physiotherapy, acupuncture, and even natural compresses can be good substitutes. Also, consult your doctor to see if there are other options that protect your hepatic and neuromuscular health. Number 12. Statins. Statins are prescribed to millions of people worldwide with the goal of reducing cholesterol and preventing cardiovascular diseases. Simvastatin, atorvastatin, and rosuvastatin are some of the most well-known. But what many people do not know is that these medications can have devastating side effects, including severe muscle pain, weakness in the legs, and in extreme cases, muscle tissue destruction. One of the most common effects of statins is myalgia, persistent muscle pain that can make everyday activities like climbing stairs or walking for long periods difficult. This occurs because statins interfere with the production of a substance called coenzyme Q10, essential for muscle health. With a lack of this nutrient, muscles are more prone to inflammation and fatigue. But the risks do not stop there. In some cases, prolonged use of statins can lead to rhabdomyolysis, a serious condition where muscles begin to break down, releasing toxic substances into the bloodstream. This can overload the kidneys, causing kidney failure and even putting life at risk. If you experience intense muscle pain, dark urine, or extreme weakness, it is essential to seek medical help immediately. Another lesser-known side effect is the relationship between statins and peripheral neuropathy. Research suggests that prolonged use can damage nerves, causing numbness, tingling, and pain in the feet and legs. This can be a major problem for elderly people, as it increases the risk of falls and severe injuries. Number 11. Aminoglycoside antibiotics. Aminoglycoside antibiotics are used to treat severe infections, but their use comes with significant risks, especially for people over 50. Drugs such as gentamicin, amikacin, and tobramycin can cause severe side effects, including damage to the kidneys, irreversible hearing loss, and peripheral neuropathy. The first major problem is nephrotoxicity. These antibiotics can be extremely aggressive to the kidneys, reducing their ability to filter toxins and causing renal failure. The risk is even higher for those already suffering from hypertension or diabetes. If you are undergoing treatment with these drugs, it is essential to regularly monitor kidney function to avoid serious complications. Another devastating effect of aminoglycosides is ototoxicity, i.e., the ability to cause permanent damage to the auditory system. This can manifest as ringing in the ears, loss of balance, and even deafness. The reason for this is that these antibiotics directly affect sensory cells in the inner ear, which do not have the capacity to regenerate. But how does this impact your legs? In addition to affecting the kidneys and ears, aminoglycosides can damage the peripheral nervous system, leading to symptoms such as tingling, numbness, and pain in the extremities. This can compromise mobility, making walking and daily activities more difficult. If you need to take an antibiotic from this class, medical supervision should be rigorous. Renal and auditory function tests should be conducted before, during, and after treatment. In many cases, there are safer alternatives, such as antibiotics from other classes that offer a lower risk of toxicity. Never accept this type of medication without a real need, as the damage can be permanent and irreversible. Follow the guidance of a qualified, specialized, and trusted healthcare professional. Number 10. Benzodiazepines. Benzodiazepines such as diazepam, alprazolam, clonazepam, and lorazepam are widely prescribed to treat anxiety, insomnia, and even panic attacks. Initially, they seem to be an effective solution for improving sleep and reducing tension. However, after 50, these medications can turn into a real nightmare, increasing the risk of dependence, falls, and cognitive impairment. One of the biggest problems with prolonged use of benzodiazepines is tolerance and dependence. This means that over time, the body becomes accustomed to the substance, requiring increasingly higher doses to achieve the same effect. The result: chemical dependence, withdrawal crises, and symptoms such as irritability, severe insomnia, and even seizures if the medication is abruptly discontinued. Another worrying risk is the increase in falls and fractures. These drugs directly affect balance, reflexes, and motor coordination, making people more vulnerable to stumbles and falls, which is extremely dangerous after 50. Many hospitalizations for fractures in the elderly are related to the prolonged use of these drugs. Benzodiazepines are also known to affect memory and reasoning, increasing the risk of dementia and cognitive decline. Research shows that continuous use can impair neural connections, accelerating memory loss, and making concentration difficult. And how does this affect your legs? Besides the sedative effect, which reduces mobility and increases the sensation of muscle fatigue, these drugs can contribute to peripheral neuropathies and pain in the extremities, leaving the legs weaker and heavier. Number 9. Proton pump inhibitors. Proton pump inhibitors, known as PPIs, include medications like omeprazole, pantoprazole, esomeprazole, and lansoprazole. They are widely prescribed to treat gastroesophageal reflux, gastritis, and ulcers. However, despite being effective in relieving acidity, prolonged use of these medications can bring serious health problems. The biggest risk of PPIs is vitamin B12 deficiency. This vitamin is essential for the health of nerves and muscles, and its lack can cause tingling, weakness, and even peripheral neuropathy. People who use these medications for long periods are at a much higher risk of developing numbness in their legs and loss of muscle strength. Another serious problem is the increased risk of osteoporosis. Studies show that prolonged use of PPIs interferes with calcium absorption, leaving bones more fragile. This increases the risk of fractures, especially in the hip and spine. If you're over 50, this is a real threat to your mobility and independence. Additionally, continuous use of these drugs can cause an imbalance in the intestinal microbiome, favoring the growth of harmful bacteria. This increases the risk of severe intestinal infections, which can lead to dehydration and systemic complications. The most concerning aspect is that many people take omeprazole daily without a real need, for long periods, without proper medical guidance. The ideal recommendation is that these drugs be used for short periods while the cause of the digestive problem is treated. Number 8. Hormonal contraceptives. Hormonal contraceptives, especially combined pills of estrogen and progesterone, are widely used to prevent pregnancy and treat problems like polycystic ovary syndrome and endometriosis. However, after 50, these hormones can become a significant health risk, increasing the likelihood of circulatory, cardiovascular, and neuromuscular problems. The greatest danger associated with the use of contraceptives is the risk of thrombosis. The hormones in these medications can make the blood thicker, favoring the formation of clots that can move to the lungs or brain. If you have a history of varicose veins, hypertension, or circulatory problems, the use of these medications should be evaluated with extreme caution. Besides the cardiovascular risk, contraceptives can also contribute to increased blood pressure, which can lead to serious complications, such as heart failure and stroke. After 50, regulating blood pressure becomes even more essential to maintain heart and brain health. Another lesser-known side effect is the hormonal impact on nerves and muscles. Prolonged use of these hormones can affect circulation in the extremities, leading to sensations of tingling and fatigue in the legs. This can worsen if the person has a predisposition to varicose veins or vascular problems. Moreover, some research suggests that hormonal contraceptives may be linked to an increased risk of depression and mood changes, something that can be even more concerning after 50, a phase of life when hormonal balance is naturally transforming. Evaluating the risks and benefits of each method with a health professional is essential to protect your cardiovascular and neuromuscular health. Number 7. Corticosteroids. Corticosteroids such as prednisone, dexamethasone, and hydrocortisone are powerful anti-inflammatories often prescribed to treat autoimmune diseases, allergies, chronic inflammation, and even joint pain. However, despite their effectiveness, these medications can have severe side effects, especially for people over 50. Prolonged use can result in osteoporosis, muscle loss, increased blood sugar, and weakened immune system. The first major problem with corticosteroids is their impact on the bones. These medications interfere with the absorption of calcium and vitamin D, essential for bone health. Over time, continuous use can lead to severe osteoporosis, dramatically increasing the risk of fractures. If you're over 50, This can be a serious threat to your mobility and independence. Many people who take corticosteroids for extended periods develop spontaneous fractures, even without suffering falls. Besides the bones, muscles are also affected. Prolonged use of corticosteroids can lead to sarcopenia, a process of progressive muscle loss that makes legs weaker and walking more difficult. This occurs because these medications degrade muscle proteins, making recovery slower and complicating muscle regeneration after physical exertion. This weakening increases the risk of falls, one of the main dangers for the elderly. Another dangerous effect of corticosteroids is their impact on blood glucose levels. These medications increase insulin resistance, potentially leading to type 2 diabetes. Many people who use prednisone or dexamethasone for long periods end up developing hyperglycemia, which can cause peripheral neuropathy, tingling in the feet, and loss of sensitivity in the extremities. The immune system also suffers from the use of these drugs. Corticosteroids suppress the immune response, leaving the body more vulnerable to infections, viruses, and bacteria. People who use these medications for a long time have a higher risk of developing respiratory infections, candidiasis, and even more serious opportunistic diseases. If you regularly take corticosteroids, it is essential to monitor your bone density, maintain a diet rich in calcium, and engage in resistance exercises to preserve your muscle strength. Discuss with your doctor ways to minimize risks. Number 6. Beta blockers. Beta blockers such as propranolol, atenolol, metoprolol, and carvedilol are widely used to treat high blood pressure, cardiac arrhythmias, and heart failure. These medications work by reducing heart rate and lowering blood pressure, which is beneficial for the heart. However, their use can bring concerning consequences for metabolism, energy, and circulation, especially in people over 50. One of the main side effects of beta blockers is extreme fatigue. As these medications reduce the force with which the heart pumps blood, some people experience a drop in blood pressure that can cause constant tiredness, dizziness, and a feeling of weakness. This becomes even more concerning when the person already suffers from natural hypotension or is prone to falls. Another problem associated with beta blockers is the impact on peripheral circulation. These medications can cause a reduction in blood flow to the extremities, resulting in cold feet and hands, numbness, and frequent cramps. This can significantly impair mobility, as the lack of proper circulation in the legs reduces the muscle's ability to receive oxygen and essential nutrients for their functioning. Beta blockers can also affect mental health. Many people report symptoms of depression, anxiety, and lack of motivation after starting these medications. This occurs because they can interfere with the production of neurotransmitters such as dopamine and serotonin, which are essential for emotional well-being. Additionally, a concerning side effect of these medications is excessive bradycardia, which occurs when heartbeats become too slow. In some cases, this can lead to episodes of fainting, dizziness, and even heart failure. If you've ever felt that your heart is beating too slowly or that your energy is very low, it may be a sign that your beta blocker is too strong for your body. Number 5. Thiazide diuretics. Thiazide diuretics, such as hydrochlorothiazide and chlorthalidone, are often prescribed to treat high blood pressure and fluid retention. These medications help the kidneys eliminate sodium and water, reducing blood pressure and swelling. However, their use can bring serious risks to hydration, electrolytes, and joints, especially after 50. The main risk of prolonged use of these diuretics is chronic dehydration. As these medications increase the elimination of fluids, many people end up with low hydration levels, which can cause weakness, dizziness, and excessive tiredness. This is especially dangerous for the elderly, as dehydration is directly linked to an increased risk of falls and serious injuries. Another common side effect is electrolyte imbalance, such as potassium, sodium, and magnesium. The deficiency of these minerals can cause painful cramps, tingling, cardiac arrhythmias, and even temporary muscle paralysis. For example, hydrochlorothiazide significantly reduces potassium levels, which can weaken the muscles in the legs and cause constant fatigue. Diuretics can also increase the risk of gout, a condition caused by the accumulation of uric acid in the joints. Many people who use diuretics for long periods develop intense pain crises, especially in the feet and ankles. This occurs because these medications hinder the elimination of uric acid by the kidneys, favoring its crystallization in the joints. If you are taking thiazide diuretics, it is essential to maintain adequate fluid and electrolyte intake. Foods rich in potassium, such as bananas, avocados, and leafy greens, can help balance potassium levels. Additionally, it is important to have regular tests to monitor electrolyte levels and prevent more serious complications. Number 4. Metformin. Metformin is one of the most widely used medications in the treatment of type 2 diabetes. Considered one of the most effective drugs for controlling blood sugar levels, metformin works by reducing glucose production by the liver and increasing insulin sensitivity. But despite its benefits, its use can bring serious side effects, especially for people over 50. One of the main risks of metformin is the development of lactic acidosis, a serious and potentially fatal condition. This problem occurs when there is an excessive accumulation of lactic acid in the body, resulting in symptoms such as extreme fatigue, shortness of breath, muscle pain, and general weakness. The risk is even greater for those with kidney or liver failure, as these organs are responsible for eliminating lactic acid from the body. Another common problem associated with prolonged use of metformin is vitamin B12 deficiency. Over the long term, this medication reduces the absorption of this essential vitamin, which plays a key role in the nervous system and the production of red blood cells. Vitamin B12 deficiency can lead to tingling in the legs, peripheral neuropathy, and muscle weakness, symptoms that can be mistaken for complications of diabetes itself. Metformin can also cause gastrointestinal problems, such as diarrhea, nausea, and abdominal pain, which can affect the quality of life of those who need the medication daily. In some people, these side effects are so intense that they lead to treatment discontinuation. Additionally, excessive use of metformin can compromise the body's ability to maintain adequate glucose levels during physical exercise, resulting in episodes of hypoglycemia, which is a sudden drop in blood sugar. This can cause dizziness, fainting, and, in more severe cases, lead to medical emergencies. If you use metformin, it is essential to monitor your vitamin B12 levels regularly, ensure a balanced diet, and, if possible, discuss with your doctor other therapeutic options that may reduce the risks associated with the medication. Number 3. Isotretinoin. Isotretinoin, commercially known as Accutane, is an extremely effective medication for treating severe acne. Although it is widely used by teenagers and young adults, this drug can be prescribed to older individuals who suffer from persistent acne cases. However, its use brings potentially dangerous side effects that go beyond the skin. One of the most serious problems with isotretinoin is its hepatic toxicity. This medication is metabolized by the liver, and its prolonged use can cause hepatic inflammation, elevation of liver enzymes, and even liver failure. People over 50, who may already have a slower hepatic metabolism, face an even greater risk. Additionally, isotretinoin is strongly associated with neurological and psychiatric side effects. Studies indicate that the use of this medication can increase the risk of severe depression, anxiety, and even suicidal tendencies. This occurs because isotretinoin directly affects the production of serotonin in the brain, a neurotransmitter essential for mood regulation. Another serious danger of isotretinoin is its impact on muscle and joint health. Many people who use the medication report intense muscle pain, joint stiffness, and weakness in the legs. This happens because isotretinoin interferes with collagen production, essential for tissue regeneration. Over time, continuous use can weaken the joints, making movements more painful and difficult. The risk of causing congenital defects is also one of the most alarming factors of this medication. Women of childbearing age who use isotretinoin must adopt strict contraceptive measures, as the risk of malformations in the fetus is extremely high. If you're considering or already using isotretinoin, it is essential to have frequent tests to monitor liver function and be alert for any changes in mood or muscle pain. In some cases, there are less aggressive alternatives to treat acne without compromising overall health. But your dermatologist will know best. Number 2. Tricyclic antidepressants. Tricyclic antidepressants, such as amitriptyline, nortriptyline, and imipramine, were widely used for decades in the treatment of depression, anxiety, chronic pain, and migraines. Although more modern medications with fewer side effects are now available, these substances are still prescribed, especially for the treatment of neuropathic pain. The problem: their use can generate serious side effects, especially for those over 50. One of the main dangers of tricyclic antidepressants is their effect on the heart. These medications can cause cardiac arrhythmias, increased heart rate, and elevated risk of heart attack. If you have a history of cardiovascular problems, the use of these drugs should be closely monitored by a doctor. Another common side effect is severe dry mouth, caused by reduced saliva production. This may seem like a minor issue, but reduced saliva increases the risk of cavities and oral infections, besides causing constant discomfort. Additionally, these antidepressants can cause intense drowsiness, dizziness, and a drop in blood pressure, significantly increasing the risk of falls and fractures in older individuals. Many patients who take these medications report a sensation of extreme tiredness, which can affect the quality of life and the willingness to engage in daily activities. Weight gain is also a frequent side effect. Tricyclic antidepressants alter metabolism and increase appetite, leading many people to gain weight rapidly. This factor can worsen metabolic problems, such as insulin resistance and high cholesterol. Impacts on the nervous system are also concerning. Prolonged use can cause difficulty concentrating, memory lapses, and mental confusion, symptoms that can be mistaken for early signs of dementia. In older individuals, this effect can be devastating, compromising independence and quality of life. If you use tricyclic antidepressants, it is essential to monitor cardiovascular and neurological effects and discuss with your doctor possible alternatives, such as selective serotonin reuptake inhibitors, which tend to have fewer severe side effects. Number 1. Chemotherapy drugs like cisplatin and thalidomide. Chemotherapy drugs, such as cisplatin and thalidomide, are used in the treatment of various types of cancer and other serious diseases. Although essential for combating malignant cells, these medications can also cause severe side effects, affecting not only the nervous system but also mobility and quality of life. For people over 50, the impacts of these drugs can be even more intense, leading to complications that can become irreversible. One of the main problems with these medications is peripheral neuropathy. Cisplatin, for example, can cause severe damage to peripheral nerves, resulting in tingling, numbness, muscle weakness, and intense pain in the legs and feet. In many cases, these symptoms persist even after the treatment is discontinued, directly affecting the ability to walk and perform daily activities. Thalidomide, on the other hand, has a dark history. In the 1950s, it was used to treat nausea in pregnant women, but caused thousands of cases of congenital malformations. Today, it is still prescribed for some diseases, such as multiple myeloma and leprosy, but remains a high-risk medication because it can cause thrombosis, neurological damage, and an increased risk of stroke. Another worrying effect of chemotherapy drugs is the impact on the immune system. These medications drastically reduce the production of white blood cells, leaving the body vulnerable to severe infections and even sepsis. This can be particularly dangerous for the elderly, who already have a naturally weakened immune system. Besides neuropathy and immunosuppression, these medications can directly affect kidney and liver function. Cisplatin, for example, is highly nephrotoxic, potentially leading to chronic kidney failure. If the kidneys lose their ability to filter toxins from the blood, symptoms such as swelling, extreme fatigue, and mental confusion can arise, seriously compromising quality of life. If you are undergoing chemotherapy, it is essential to monitor your symptoms and report any signs of weakness, pain, or numbness in your limbs to your doctor. In some cases, there are strategies to minimize the damage, such as supplementation with B-complex vitamins, antioxidants, and neuromuscular rehabilitation therapies. Maintaining a balanced diet and engaging in light exercise can also help reduce side effects and improve the body's recovery. And if you want to continue receiving the best videos for your health, subscribe to the channel because it exists for one reason: to make you a healthier person with a better quality of life. Helping you is my mission. In the video that now appears on your screen, I reveal the worst food for your heart, even worse than salt. Click on the screen and check out. So, see you in the next video.